Becky is the telehealth coordinator for the Indiana Telehealth Network. And many of you know that she has been working tirelessly, in my opinion, over the years to develop a project which was a vision that happened about 5 to 6 years ago with the formation of a technical advisory committee from St. Vincent's participation, Clarion, the IU School of Medicine, a number of other individual healthcare providers. And the focus was, how can we develop a network in Indiana which has the ability to transfer healthcare information, to do video conferencing, do training, all kinds of potential uses. When we started the vision, it was a $17 million FCC grant that came to Indiana. And a lot of work went into that. Today, and as of the first of the month, Becky has online on the Indiana Rural Health Association website a 3-page report that updates you on where we stand today. And it is extremely valuable. 19 critical access hospitals, 4 rural hospitals, 5 urban hospitals, 5 rural health clinics, 7 federally qualified health centers, and 18 county mental health organizations are all tied to one network today in the state. Now, as you watch these slides going by, you'll see different aspects of the telehealth network that are on there. And I just felt that this was something that our work with Senator Lugar over the years, with Becky, with the Indiana Rural Health Association, and with the Telehealth Network in particular and its members, because they have sought individual grants. The Lugar Center in Terre Haute, the IU School of Medicine, St. Vincent's, Clarion. The benefit of bringing together those groups is not yet fully understood in Indiana. We have the potential to also join together with the research and development BioCrossroads and the access to international health aspects that we yet today don't fully appreciate. The telecommunications revolution is also occurring in the hospitals, in the clinics, and patients are seeking more and better information. And Becky Sanders is leading the way for Indiana to bring this together. And so, Becky, on behalf of Senator Lugar, I'd like to present to you a certificate of recognition, Becky Sanders, Network Coordinator for the Indiana Telehealth Network, in recognition of your dedicated service to your community and with appreciation for your invaluable contribution to the state of Indiana, presented this day.
Thank you so much. This is totally a surprise. But we were recently, we've started to do some hospital visits, and I've been working closely with the folks from IRHA and Lieutenant Governor Skillman's office about different site visits that Lieutenant Governor Skillman is doing as she's going around on her Crossroads tour around the state of Indiana to all 92 counties. There's a lot of things that Lieutenant Governor Skillman is trying to highlight as she goes around the state, but broadband is one of them. And recently we did make 2 visits. We visited St. Vincent Williamsport up in Warren County, and we had a great turnout there. That construction bill for the Indiana Telehealth Network was somewhere in the neighborhood of $750,000. So the 15% match under the FCC pilot program was still over $100,000, and it would not have been possible without the local economic development organization and Steve Everly, who's the county commissioner in Warren County. Another visit we made recently, I saw Linda Simmons this morning, she's out there somewhere. We were able to visit Decatur County Memorial Hospital, and they're on our list of video conferencing sites. The video conferencing program is very, very important to the distance learning education that we're bringing on, and we're starting to do a lot of administrative meetings. But it allows folks at those facilities to be able to stay at those facilities for many of the IRHA meetings. And we're trying to create different areas around the state where it's only a half-hour or 45-minute drive instead of 2 or 3 hour drive to attend those meetings. That particular part of the Indiana Telehealth Network, the video conferencing piece, is funded by our flexibility program. Any COS CEOs that are here today, I invite you to stay after our meeting this afternoon. We're having a Flex Advisory Committee meeting this afternoon, and we'll be talking about the video conferencing program there. But it's amazing when we were at Decatur County to think about where we've come in the last, it's almost 4 years. My 4-year anniversary is coming up here in a couple months. And Don, did you hit your 4-year anniversary just recently? But it's amazing. We've climbed many mountains. There's been a lot of blood and sweat and tears. But we do have almost 60 different hospitals and clinics that are signed up for the Indiana Telehealth Network. Right now there's a lot of programs that are, a lot of sites that are in construction and a lot of sites that are already connected. Smithfield Digital is here today. They have a booth today, and they're one of our premier partners in that project. Thank you very much.